Your periods suddenly become unpredictable. You're waking up soaked in sweat for no reason. Your heart starts racing while you're just sitting on the couch. You forget a word you've used 1,000 times. You're gaining weight, even though nothing about your diet has changed. If any of this sounds familiar, you're not losing your mind, and you're not just getting older. These symptoms may not be random at all. They could all be connected to one major biological transition happening inside your body called perimenopause. And here's what most women are never told. Many of these symptoms are dismissed as normal aging, stress, or just getting older, when they're actually signals your body is sending you, months or even years before anyone mentions the word menopause. Stay with me, because by the end of this, you'll understand exactly what's happening in your body, system by system, and which signs actually need a doctor's attention. Perimenopause is the transitional phase leading up to menopause, when your ovaries gradually produce less estrogen. It typically begins sometime in your 40s, though for some women it starts in their late 30s. Menopause itself is a single point in time, marked officially after 12 consecutive months without a period. Perimenopause is everything leading up to that point, and it can last anywhere from a few years to closer to a decade. The reason symptoms feel so unpredictable is that estrogen doesn't decline in a smooth, steady line. It rises and falls erratically during this phase, sometimes spiking higher than normal before crashing. That hormonal turbulence is why you might feel fine for a month, then hit with 5 symptoms at once the next. Let's look at every major warning sign, organized by what's actually happening in your body. Start with menstrual changes, because this is usually the first sign women notice. Cycles can become shorter, sometimes arriving every 3 weeks instead of 4. Other months they stretch out longer, or you skip one entirely. Bleeding can become heavier than you're used to, or lighter. This happens because ovulation becomes inconsistent, and without regular ovulation, the hormonal signals that used to keep your cycle on a predictable schedule become erratic. Next, hot flashes and night sweats. These are caused by estrogen's role in regulating your brain's internal thermostat, located in the hypothalamus. As estrogen fluctuates, that thermostat becomes more sensitive to small changes in body temperature, triggering sudden blood vessel dilation near the skin's surface. That's the flush of heat, the sweating, sometimes followed by chills. It's uncomfortable, but it's one of the best understood and most common symptoms of this transition. Then there's brain fog, trouble concentrating, forgetting words mid-sentence, walking into a room and blanking on why. This isn't early dementia, and it isn't in your head. Estrogen receptors are dense throughout the brain, including regions tied to memory and verbal recall. When estrogen fluctuates, those systems temporarily struggle to fire the way they used to. For most women, this cognitive fog improves after the transition stabilizes. Sleep problems often follow closely behind. Difficulty falling asleep, waking up multiple times a night, and night sweats disrupting deep sleep all compound each other, leading to daytime fatigue that feels disproportionate to how much time you actually spent in bed. This is partly hormonal, and partly the downstream effect of poor sleep quality itself. Mood changes are common too. Increased anxiety, irritability that seems to come out of nowhere, feeling emotionally overwhelmed by things that never used to bother you. Hormonal shifts absolutely contribute here, but it's worth being honest. If these feelings become persistent, severe, or start affecting your daily functioning, that's not something to just wait out. That deserves a conversation with a doctor. Heart palpitations catch a lot of women off guard. A racing or fluttering heartbeat, sometimes with no clear trigger. Hormonal fluctuations can affect the autonomic nervous system, which influences heart rate. In most cases, this is benign, but palpitations paired with chest pain, fainting, or shortness of breath are not something to attribute to hormones without medical evaluation first. Weight and metabolism shift too. Metabolism naturally slows, fat tends to redistribute toward the abdomen, and muscle mass declines with age, regardless of hormonal status. This is exactly why maintaining strength through resistance training becomes more important during this decade than almost any other, since muscle is metabolically protective long term. Skin, hair, and nails change as estrogen supports collagen production. As levels drop, skin can become drier and thinner, hair may thin out, and nails can become more brittle. Sexual and urinary symptoms are common, but rarely discussed. Vaginal dryness, discomfort during intercourse, and a drop in libido occur because estrogen keeps vaginal and urinary tissue healthy and well lubricated. Lower estrogen can also make you more prone to urinary tract infections and increase urinary frequency. Finally, joints and bones. Aching joints and muscles are frequently reported, and bone density begins declining more quickly as estrogen drops, since estrogen plays a protective role in bone maintenance. This is part of why bone health monitoring becomes more relevant heading into your 50s. Now, when should you actually see a doctor rather than assuming it's just perimenopause? Very heavy bleeding that soaks through protection quickly. Any bleeding after 12 months without a period. Chest pain, fainting, persistent heart palpitations. Unexplained weight loss. Severe depression, or any thoughts of self-harm. None of these should ever be waved away as just hormones. Perimenopause can explain a lot, but it should never become an excuse to ignore something serious. The reason perimenopause touches so many different parts of the body, from your brain to your heart to your bones to your skin, comes down to one biological fact. Estrogen receptors exist almost everywhere in the body, not just the reproductive system. That's why the symptoms feel so scattered and confusing. They're not separate problems. They're one transition, showing up in different systems at different times. Understanding that connection is the first step toward recognizing what's happening in your own body, having an informed conversation with your doctor, and making decisions based on evidence, not fear.